Carly Adams, physical therapist and orthopedic specialist for Wasatch Therapy. Today I'm going to briefly touch on one of my other specialty areas, which is treating chronic pain. So the area of chronic pain is kind of an area that's become more popular recently because of items in the news such as the opioid crisis. This opioid crisis is basically a realization of our medical community that we haven't been treating pain correctly and people have been addicted to these medications that aren't even helping them anymore. So the big question is, well, how do we treat chronic pain? How do we treat pain that people have been in for at least 3 months or longer? It can be years. I am treating one gentleman who's been in pain for over 25 years and he doesn't know how to modulate it or change it. Before I get to how to treat it, let's talk about what chronic pain is. So I already touched on the fact that chronic pain is pain that persists for at least 3 months. It usually is associated with a trauma. It can also be associated with osteoarthritis or some kind of rheumatic disease. Often people that have had persistent back or neck injuries for some time will tend to have this. And just a lot of people just have a combination of how their body works as well as having certain degenerative conditions over time, and this pain state just sticks around. So people are looking for how to treat this. More and more research is coming out that there are effective ways to manage pain, and the great thing about what I do as a physical therapist is it falls right in line with how I treat. So the first thing I do in physical therapy to treat chronic pain, we'll talk about two things today. The first thing is educate. More and more research is showing that education will actually help to change the brain chemistry in our bodies, which can modulate the pain. The reason that it's important to change our brain chemistry is that our nervous system will experience pain differently, and usually differently, especially in this positive realm, means less pain. So going to my number one here, education. You need to learn about is the brain and its connection to the rest of the nervous system, which is what controls pain. So you have your head up here. This is your brain. Isn't that a great brain? And then you have your spinal cord, and it feeds the arms and the legs and all through here. Okay, so this is brain here. All of our impulses are feeding back up here, and then we have impulses coming down. So the impulses coming up when we've been in pain for a while are less reliable. Our research has clearly shown that. The great thing is that with how we think, we can send impulses back out that tend to help us filter what is meaningful coming into our brains and what isn't. Therefore, we're going to reach a lower pain state. Secondly, the way we're going to treat chronic pain is we're going to exercise. And we're not going to do intense exercise. We're not going to take up marathon running or high intensity CrossFit, but just start with low level cardiovascular exercise at least 5 times a week. And I mean, this can start anywhere for somebody. The reason we do this, though, is to improve circulation in our bodies, which helps to move the pain chemicals off painful tissues. And secondly, we get this release of what's called endogenous opioids that will help to calm down the pain in our bodies. The great thing is these opioids are natural. They're not from a chemical that we're putting into our bodies, so we can get some natural pain relief that way. So this is just a quick intro to treating chronic pain and what I do. It's very personalized and individual for each person. So if you have somebody in your life, or if this is you that needs more education and help in this way, please come see me at Wasatch Therapy in Roy. I'd be glad to help you.